Impedance planimetry values for predicting clinical response following peroral endoscopic myotomy. Introduction. There is growing interest in developing impedance planimetry, an endoscopic device that measures esophagogastric junction distensibility, as a tool to optimize the technical aspects and clinical outcomes of endoscopic and surgical treatments for achalasia. Disruption of the hypertensive lower esophageal sphincter is the primary target for therapies directed at treating achalasia. Impedance planimetry directly measures pressure and cross-sectional surface area, CSA, at the sphincter. The distensibility index is an indirect measurement calculated by dividing the CSA by pressure. A low distensibility index accurately predicts the presence of achalasia and has been widely incorporated into the diagnostic toolbox for this disease. Based on preliminary data in patients undergoing peroral endoscopic myotomy, POEM, for the management of achalasia, higher post-procedural CSA and distensibility index measurements are associated with a favorable clinical response. Importantly, these higher values are also associated with higher rates of reflux, an important long-term consequence of disrupting the lower esophageal sphincter. In the published literature, there is a large variation in the reported optimal range of impedance planimetry measurements that are most predictive of a clinical response. This is a likely consequence of the low numbers of patients included in previous studies, which are mainly single-operator and/or single-center studies. To improve clinical outcomes of patients undergoing treatment for achalasia, this optimal range needs to be clearly defined. Background. There is growing interest in developing impedance planimetry as a tool to enhance the clinical outcomes for endoscopic and surgical management of achalasia. The primary aim of this study was to determine whether impedance planimetry measurements can predict clinical response and reflux following POEM. Methods. A multicenter cohort study of patients with achalasia undergoing POEM was established from prospective databases and retrospective chart reviews. Patients who underwent impedance planimetry before and after POEM were included. Clinical response was defined as an Eckhart score of 3 or less. Tenfold cross-validated area under curve, AUC, values were established for the different impedance planimetry measurements associated with clinical response and reflux development. Results. Of the 290 patients included, 91.7% had a clinical response and 39.4% developed reflux following POEM. The most predictive impedance planimetry measurements for a clinical response were percent change in cross-sectional area and percent change in distensibility index, with AUCs of 0.75 and 0.73 respectively. Optimal cutoff values for percent change in cross-sectional area and percent change in distensibility index to determine a clinical response were a change of 360% and 272% respectively. Impedance planimetry values were much poorer at predicting post-POEM reflux, with AUCs ranging from 0.40 to 0.62. Conclusion. Percent change in CSA and distensibility index were the most predictive measures of a clinical response with a moderate predictive ability. Impedance planimetry values for predicting reflux following POEM showed weak predictive capacity.